A baby that comes into the world being immediately exposed to a bunch of actually dangerous things. I mean, we can list them off. They were induced. They were forced out of their home early. Then, or maybe we augmented. Maybe we ruptured the waters, and there was this dropping into the pelvis. Like now that the waters are flooding out before the baby was even, finished counting its fingers. Right? Maybe a C-section.
Welcome to the Experience Miracles podcast, where we help parents find hope, answers, and drug-free help to overcome your child's chronic health challenges. I'm your host, Dr. Tony Ebel, and I'll be sharing my experiences as both a dad and a doctor on every episode. I can take the latest science and neurology of healing and break it down in the most simple and relatable way possible. We'll take on the toughest topics and answer your biggest questions through interviews with other amazing parents and leading experts, leaving you with practical action steps that you can take to help your child heal and thrive. It's time to expect and experience miracles. Let's get started. All right, parents, welcome to another episode of the Experience Miracles podcast. This is the podcast. If you have listened to one episode or all 20 or whatever it is, I don't know, by the time this one comes out, you know that we get after it. We really do deal some hope on this podcast. We really do get into the truth. We get sciencey, we get nerdy, we get neurologic-y, which is not a word, but we don't usually make up a ton of words on this podcast. We get into stuff that we know you need to learn to have healthy, resilient kiddos who can, for a lot of you, first heal from some chronic challenges without drugs that they may be going through. And then second, just transform your whole family's life to be healthy, to be resilient, to have that goal, that outcome that we all want for our kids and our families, which is health and happiness. And all of that starts with pregnancy. Actually, all of that starts with preconception and fertility, and then goes to pregnancy, and then it goes to labor and delivery. So once we get into the episode, you're just going to see I guess you're going to hear it. It's a podcast. You're going to hear Dr. Nathan's heart. You're going to see and understand the wisdom and the experience. He gets real granular and real nerdy and teaches us some incredible stuff. He teaches me some stuff I had no clue about. And now I am so excited that I do, because I better understand why kids are struggling, and I better understand how to help kids. And that's the whole goal of this podcast, is to give you greater clarity. Yes, a lot of times we have to start with a greater clarity, a better understanding of why your kiddo's sick in the first place, because that then immediately leads us to the action steps and the drug-free solutions that'll help. And Nathan does an incredible job during this podcast. So let me give you his bio. Let me give you all of the things he's gone through to get this awesome, as I would say it, and then we'll get right into this episode. Nathan is a home birth doctor and holistic gynecologist living in Louisville, Kentucky. He received his MD from Temple University and completed his OBGYN residency at Kaiser in Los Angeles. He completed his fellowship in hospice and palliative care at UC San Diego and is a dual board certified in allopathic medicine doc. And he brings his tools from other modalities like functional medicine, nutrition, exercise science, and lifestyle coaching, midwifery, and so much more to optimize the care of his clients. He is married to his high school sweetheart, and they have two beautiful girls. And he shares from that perspective of his second daughter's home birth and just the things that they are awesomely doing to ensure that their kiddos are being raised healthy, regulated, resilient. And those are terms: resiliency, nervous system regulation, adaptability, variability. These are terms that maybe when you first hear them, they're brand new and they're foreign. But the way Nathan teaches us today, and the way him and I jam on this podcast episode, we bring it to a place where it's going to empower you and inform you to help massively if your family's still growing and there's another pregnancy and there's another labor and delivery coming down the road, or maybe more than one for your family. And also, if you went through some of these things that happen that we'll talk about during birth, during labor, and during early infancy, well, then this is going to give you a greater understanding and a greater clarity as to maybe why your child is struggling and what can be done and needs to be done to get them out of that sickness, that chronic illness, that stress that they may be going through. You're going to become so empowered. You're going to have fun with this episode. Like always, we crack a few jokes. It's two dads jamming about a very important conversation. So we keep it light, we keep it engaging, we keep it fun. Here's the episode, Dr. Nathan Riley. All right, Nathan, brother man, here's how I want to start this first question. And I'm such a talker and run things together that it's probably multiple questions mixed into one. But when we got connected through Instagram, which is awesomely where a lot of us are on this same mission to get this truth, to get this real, actual science out to moms and families and everything. And I'm diving into your content. And I think I can't even remember the exact details. It was Dr. Lindsay and Dr. Stu, and then I made a comment, and then there was a DM, and we were both. It was awesome. It was so fun talking to you because of this. You were so open. You were so receptive. You were so I would use the word stoked and excited to learn from something that maybe I knew that you yet didn't. And every time we get to jam with parents, probably like the most common phrase that parents will say to us after we teach them about the stuff we're going to jam on here, and we talk about on this podcast with the nervous system, with the vagus nerve, with birth trauma and the perfect storm, parents always say, "Oh my goodness, I didn't know that. I can't believe nobody told me that before, or nobody taught me that before." And then they become intrigued, and you get to empower them and inform them even more. And this relationship just builds, and people and kids get healthier as a result. That is the normal way it goes there, brother man. The way it doesn't normally go with other doctors, especially who share your initials, is when they learn about this stuff. Same science, same brand new. I get it. I didn't learn this stuff in chiropractic school. They didn't learn it in medical school. Nobody in kind of any school learned what you really learn in practice. And so whenever this conversation goes in their direction, I would say 9 times out of 10, and I'm probably low on that number, the door is shut. There is no intrigue. There is no openness to learn more. And I've spent my whole career as an obsessive learner, and I can't wait to learn from anyone, no matter where they're coming from, no matter what initials they have. I don't care. If it helps kids get better, that's all I care about. So my first question is kind of a personal question. What has shifted in your career that has left you awesomely so open-minded, so on this journey to learn more? Where did that transformation or moment or series of moments come from?
Yeah, I guess thank you, Tony, for having me, by the way. Let me start by saying you just did an interview with Stu Fishbein, who's another OBGYN. He's no longer board certified, but had been. And I kind of have picked up where he left off in some regards. I can't fill those shoes because Stu has inspired and impacted so many people's lives over his illustrious career that it's hard for me to even, it gives me something to aim for. But
love it.
The reason I bring him up is that so much has changed in the landscape of medical education that looking back, I'm not even certain how I got here. I always wanted to be a doctor. I don't know if I saw another avenue for me. I first was thinking physics. I wanted to be an astrophysicist, believe it or not. I was the best physics student around. I was in all of the advanced placement classes, and I got to be really, really good friends with my high school teacher. We don't call them professors, I guess, but my high school teacher, Mr. Wargo, who has since passed away, but he and I met up after I had finished high school, and I went to college at the University of Pittsburgh, which is my hometown. So I was walking around on the campus, and I saw Mr. Wargo there, and I started talking to him, and he had some health problems, and he has since passed away. May he rest in peace, because he was probably the most important, most influential figure in my educational experience after 20 years of school. And he had told me, we were walking, and I said, "Hey, do you want me to help you find the clinic or whatever?" And he was like, "Yeah, that'd be great." And I was walking, he's a little feeble. And he said, "Nathan, I've been thinking I think about you sometimes." And he said, "What was such a joy about you was not that you earned A's." He's like, "Anybody can earn an A." He said, "You were always just so curious." Yeah. And you kind of brought this up just now, where that curiosity and intrigue is actually what drove me to obstetrics and gynecology. But it was never rewarded along the way. I was never really being incentivized to ask questions. And so that's why I say I'm not exactly sure how I ended up here because most of my colleagues, they're great people who went into the sciences for all the right reasons. They've somehow lost that luster to just be wrong. And when you approach any problem, as I'm sure you approach problems, I'm hoping to be wrong, because then it allows me to find another door to open to try to find the right answer. But
Yeah.
if we just accept everything we're told, then, we tend to run into problems. There's I was also a literature student in college, and I read a lot. I was a Spanish literature student, so it wasn't even in my own language. But Ivan Illich gave a speech back in Cuernavaca in 1968, and since has written some tremendous books. And he had said in one of his books, Deschooling Society, he said, schools are designed on the assumption that there is a secret to everything in life, that the quality of life depends on knowing that secrets can be known only in orderly successions, and that only teachers can properly reveal these secrets. An individual with a schooled mind conceives of the world as a pyramid of classified packages accessible only to those who carry the proper tags. And so looking back at somebody who has climbed the ranks of the academic world, I don't feel like I have any answers. And that allows me to remain to be curious and to put what's important here, which is the people that come to me for help with their health, with their pregnancy, with their fertility, and to really ask genuine questions in hopes of trying to help them find a solution.
Yeah, I'm a person who has, I always joke with my kids, these forehead wrinkles are there because I've spent so much of my life blessed to be smiling. And maybe they come from intrigue too. Maybe I've spent 50% of my life with this inquisitive look, which maybe, fosters wrinkles, and then smiling because it's this is fun. I'm learning something new and I'm meeting people who could teach me new things. I can't be more aligned with exactly what you just shared. In fact, it's kind of crazy. When I met Dr. Stu and we started to get to know each other, what blew our minds is we both grew up huge Minnesota Twins fans. So we kind of had that in our, backstory, which is kind of a random, alignment with that. From this here, brother man, my most influential professor by far was in undergrad, and it was a physics professor. And he just taught me exactly that. He taught me to be inquisitive, that it's not about going, here's the problem, there's one right answer. You're here to learn. What he taught us was the path with which you would find better answers and make sense of all the things going around. Well, physics and neurology and physiology are very similar in this conversation, where science is definitely something that needs constant investigation, constant upgrading, constant inquisitive to it. And what we've done, it's interesting you bring up that educational background too with your story, because we know that medicine turned for the worst back when the Flexner, the Rockefeller, when they shifted the educational. Now, if you run medicine like a business, like it is, traditional medicine, well, then you're smart to make this move. You swim upstream to the students and you shift them. And really what we're talking about here is you shut down their ability to go after the root cause. You shut down their ability to ask questions, and you shut down their ability to collaborate, especially with folks that would be like a chiropractor or a naturopath or someone that is root cause, so there's this pre-planned system that very few like you get out of. And that's frustrating because what parents are looking for is you. I'm just going to say it. They're looking for a doctor who has the humility, yet the excitement to partner with them and say, I might not have today the answer to every question you have. I've always promised my patients this. I was like, I'm going to only answer your question if I can answer it with clarity and conviction based upon not just my education, but my experience and everything else. And if I don't have that, if I don't have the ability to answer with clarity and conviction, well, then give me 24 hours. I'll go home, do the homework, and call you back. You know what I mean? Call you back. Hit you up as soon as I have it. So let's go there. One of the things that you probably heard it even listening to Dr. Stu's episode when I went on my rant about birth trauma, vagus nerve dysfunction, dysautonomia, subluxation, and its connection to this whole perfect storm, which for millions of kids today ends up in autism. He was kind of taken aback by that and went, I hadn't learned that before. I hadn't seen it so clearly before. And I know in our interactions, that might be a similar path that we've been able to kind of move you down. I don't know how to really kind of say that, but as you've gone, and that was a couple of months ago when we went through that, because one thing that has bothered you, I don't know if that's the right way to say it, but in a good way, is autism. And you're in the birth world and you understand how much it's been shifted to intervention, and a really close I word to intervention is injury. to the brainstem and to those areas. So where are you? I guess now that I'm in it already, to frame up the question, when you look at that potential connection and the science there with your awesome, open-minded, intrigued, investigative process, what are you finding right now in the connections between pregnancy, birth, vagus nerve, autism? And I know that's a big loaded question, but run with it a bit. What are you seeing? What are you learning? What are you thinking?
Yeah, Tony, I am just remembering now that the way that you and I got connected was a comment you made on a post I had done after getting off of a phone call with a woman whose baby likely had a hypoxic injury in childbirth. And what that means is that perhaps that baby could have been expedited, their birth could have been expedited in some way, and it wasn't, maybe prematurely, right? Now, we'll talk about continuous fetal heart rate monitoring, which is probably the main contributor to the change in how babies are coming into the world, which is important to this conversation. But let's go back in time, right? What you have brought up so many times in such beautiful ways and articulating it better than anybody I've heard is the role of the environment on what we're seeing as a hockey stick curve. There is something happening here. And yes, it's epidemiological, but that should prompt deeper investigation. It doesn't seem to be doing that. And so then, of course, the question is, what is causing this? I think you're correct in addressing the reality that the shifts that we have seen in the middle of the 20th century around how babies are being born is probably the contributing factor. But going back to that phone call I had with this woman, she had sent me the fetal heart rate strips and whatnot. And she said, my son was just diagnosed with autism. Could the birth injury have led to that? So let's pause here for a second. Could a birth injury lead to autism? Maybe. It's going to be hard to prove that as a single causative factor. However, the way that we grow babies, heck, the way that we conceive babies, the jabs, this state of fear in hospitals and for many women and their partners in childbirth, all of this is a rattling of the cage that is the nervous system. And then could a birth injury have predisposed them to all of these other mitigating factors? Absolutely. So what we have here is a very, very complex Gordian knot, all of which, all of these factors are contributing. So where do we start? Well, maybe we could start with those things that we're doing that don't need to be done.
I am so in the storm helping pull kids out of it who are already in it. It's hard for me. And I wish it were different to swim upstream and go, what's the list of things, because I'm also not in that world. So even if I knew the list, what could I do about the list, right? But what is the list to prevent the dang perfect storm? So keep rolling, brother. I love this.
Right. And of course, the ambience of the birth room, when you compare a home birth with a C-section, right off the bat, we have a nervous system shocking, right? Totally. But even before that happens, what do most women do? You and Dr. Stu riffed on this high risk, low risk thing. Yeah. Risk, as Dr. Stu says, is not a number. Risk is a threshold above which we feel, hey, as the individual making the decision, this might not be the right decision. Below that threshold, whatever my personal threshold is, hey, I'm willing to take the chances. Yep. That can be helped it can be guided by the numbers, and that's a part of it. But we'll get into what real evidence-based medicine actually looks like. The point here is that when you get onto the medical train, universally across the United States, every single maternity unit is going to default to what's called continuous fetal heart rate monitoring, which is different from what midwives do. I am not saying that it's not useful to sometimes listen to the baby's heart tones to see if we can find some aberration that may lead us to counsel in a different way that may result in transfer to the hospital or even expediting the birth in the hospital. But what I am saying is that when we nearly universalized this in the late 90s, early 2000s, what we were hoping to see, Tony, was a drop in our cerebral palsy rates, and we did not see that. Instead, we saw a skyrocketing. Again, it's not quite a hockey stick, but it was a pretty darn big jump from the 60s, 70s, 80s, 90s, and then especially in the 2000s. Our C-section rates skyrocketed. And what can we say about that? Well, most doctors would say, I did a C-section because the tracing didn't look good. Well,
Okay.
what is this tracing thing in the first place? The tracing is meant to reflect heart rate variability. It's meant to reflect what we call accelerations, where there's a sudden rise, sympathetic tone kicks on a little bit, and then you get a drop down. We get decelerations, which is a sort of like a bradycardia, where you get this drop in the heart rate. So this is reflective of the baby's nervous system, not the heart necessarily. The heart is our surrogate. So all of this is to say that if you got 100 OBs, and they've studied this time and time again, into a room and asked them to interpret a tracing, they're all going to disagree. And then if you ask all of those same people to review the same tracings in a year or two, they're going to have at least a fifth of them, 20% are going to have a different interpretation from their first assessment. So we have a problem here. We have this universal means of, quote, keeping a baby safe that is highly variable in how the doctors and the clinicians who are really paid to interpret these things and help you make decisions, how they would interpret them. So as a consequence of a variety of factors, including the business of medicine, the medical legal issues we all deal with, doctors are never sued for the C-section that they do. They're sued for the C-section they don't do.
Yeah, indeed.
And they just have a lower threshold. And now we have a reason to do the C-sections. And of course, now that it's universal, doctors are just a little too afraid of that bad outcome. And instead they say, we don't want a dead baby. That's the worst outcome. Of course it is. But what about all of the other things that come as a consequence of so many babies, 37% now nationally, coming out of the abdomen?
I love this. This is my favorite job. Now I have another way to learn things. I have a podcast and I get to, the world is connecting us with other brilliant people who come on here and teach me stuff. I mean, obviously I've heard of fetal heart rate monitoring and I knew its general role, but I did not know those details. And those are so helpful for me to understand. I definitely did not know there was no consistency in terms of, hey, this reading means this, and therefore all doctors will interpret it. And that's interesting because in our work, we use scanning. We use heart rate variability, and we can actually put it on an ear clip or a finger sleeve. So heart rate variability, along with two other sets of scans, neurothermal scans, which are more regional dysautonomia, and then surface EMG, which will give us the gross motor and the neuromotor system, which is motor development is essential for kids. Well, obviously, you can only run those scans once they're on the outside. So anyways, the HRV is the leading technology, and it's not even close as to dictating our clinical decision-making. And that's not just in chiropractic. That's in a lot of other places, right? We're linking HRV. Yeah. So going granular just for a second, how much can these heart rate monitors on the infant in those moments, how much of the variability does it give you a specific scoring to variability? And maybe this is more detailed than it's worth, but how much, I knew acceleration, deceleration, and kind of the sheer number, how much of the variability is it actually reading with the intermittence and the beats and everything else?
Okay, so yes, this is a great question, and I think it is relevant, even if it does seem like we're getting in the weeds, because at least 98% of the women who are listening that are going to have a baby are going to end up in the hospital with one of these monitors on their belly, right? So and let me also preface by saying that there are hospitals out there who are experimenting with intermittent monitoring and whatnot, but the truth of the matter is we have a technology here that needs to probably be replaced with something else because it really it hasn't stood the test of time. But given that it's the best we have, we don't do fetal scalp sampling anymore. What we do is we take blood and we actually look at what is the acid-base balance in the blood. Because if a person is in a state of acidemia, it tells me that they're not getting enough oxygen, right? Just like whenever you do a hard workout, you start breathing extra to exhale that CO2, right? So to your question, walk into any maternity unit in the country and you'll see a bank of televisions that have this little squiggly line. Based on what we see there, you're able to rapidly assess after seeing this so many hours spent staring at these monitors. You can say that baby's maybe in trouble, that baby's probably in trouble, and that baby, we don't even need to worry about that one. That's fine. Okay. Those three categories are category one is the green. Well, we won't use green, red, yellow, or yellow, red, because we're probably going to get into polyvagal a little bit. But
yeah, totally.
in the vagus nerve. But category one is good. Category three is we got to act now, and category two is somewhere in the middle. And about 80% of tracings, that's anecdotal, are like category 2. You could argue, in other words, that like, oh, maybe that baby's in distress. I'm not totally sure. And it's those big chunk of category 2s that do require us to pay a little bit of attention, maybe do some, non-invasive intervention, repositioning, some fluid hydration, whatever. And if it improves, then it goes to category 1 and we don't worry about it.
Yeah.
But here's the kicker. Almost anything can make it a category 2.
Yeah.
And if it doesn't improve and we are still concerned over an hour or so of waiting, then hey, I think it's better to have the baby out. You don't want your baby to die, right? And naturally, any parent is already exhausted. They're already kind of nervous because they're in a hospital that doesn't feel safe. And they just go along with the program.
In that setting, the likelihood of, having a couple of moments or whatever period of time in category 2 with, so we'll call it mild to moderate distress. And then, we changed positioning. We did some empowerment. We changed how much ambiance can a hospital room really change? How much can we throw the essential oils of Bob Marley on? Not a lot, in most hospitals, right? And so you're probably not going to go from a 2 back to a 1 and find that state of ease and parasympathetic regulation and nervous system regulation. You're much more likely to go from a 2 to a 3, especially with these 2 things. And there would be way more than 2, but we'll pull these 2 out from my brain, especially knowing that most moms are coming in distress. Most moms are spending their entire pregnancy in category 2, probably at minimum, right? Their nervous system is distressed. So what we've seen in the last 5 to 10 years, and obviously COVID accelerated this, you could almost call it deceleration because it went down in quality of HRV. Moms' HRVs have plummeted over, I've been in practice 16 years and I've been running HRVs on all my patients from pregnancy to infants to everybody from the beginning. So I'm measuring their resilience. I'm measuring their adaptability. We're measuring whether they're stuck in a sympathetic storm, which would be a poor HRV, or whether the vagus nerve and the parasympathetics, the safety, the relaxation, the growth, the birth, mode is on. And so going into labor and delivery, we have seen moms' nervous systems be more sympathetic dominant, be more in distress. So that would be factor number 1 is neurology, nerves that fire together, wire together. So in that moment, mom's nervous system is baby's nervous system, right? That connection is still there. So we're measuring baby, AKA measuring mom too. And then also that setting is so distressful, most of them, that the pathway is going to go to level 3. Okay, that actually answers a ton for me in granular detail in terms of like the innards of what's going on there and why most of the outcomes are in that direction. So love that. I can see going forward because you could even, I know enough about HRV to know like, well, what technology? How accurate is it? You know what I mean? And those other things too, because yeah. So, that's anywhere, everybody listening, whatever job you do, you don't have to be an OB or a pediatric chiropractor using this technology, whatever technology you use that is foundational, probably super fundamental to what you do, it'll be way better in a year. It'll be way better in 3 years, and it should be. And that's good. But even if the technology improves, does the interpretation, the clinical decision making, right? And so that's our conversation going forward there. So
a quick tip for people, if you're on one of those monitors, based on what you and I just described, it sounds like, well, phooey, let's get rid of all of it. Let's not get rid of all of it, but let's use it with some discernment. Have some babies been saved as a consequence of seeing something pop up on an abnormal tracing? Absolutely. Have a lot of babies had to come out by C-section as a consequence of us thinking there's a baby in distress and the baby's not actually in distress? Absolutely. So it's not a perfect system. Is it sometimes helpful? Great. Is it the best we have? I guess so for right now. But here's the 2 pieces of information you can glean from there, from one of these tracings in that maternity ward, that will almost definitively tell me that the baby's okay. And this is how I got my C-section rate down, believe it or not, to hovering between 7 and 8% ever since residency.
Amazing. Amazing.
That is something I should be proud of because most doctors are not saying, hey, I'm the one who did all the unnecessary C-sections, guys, right? Like, it's my fault, my bad, I'll get better. We all think we're doing the right C-sections. But there was an MFM who used to practice at the hospital where I trained. His name's Emiliano Chavira. He's also friends with Dr. Stu. Emiliano was also one of my mentors when I was in residency, and he left very, very shortly after I started. He went to a different hospital, but our very first day as interns, that's our first year as brand new residents, fresh out of med school, he gave a talk on the oxygen delivery pathway from the external environment to the baby. And he compelled us to consider how many steps along the chain is required for the baby to get oxygen and how we can intervene at each of those various steps. And here was the kicker. He said, when do you actually have to intervene? When are you really worried? And we were new. He was asking us a question in order to prompt a shoulder shrug, right? And he said, here's the two things. If you see moderate variability, not marked variability where you get this fluctuation wildly above the baseline and below the baseline, and not minimal, meaning almost a flat line. If you get moderate, which is, for the geeks out there, 5 to 25 beats per minute on a moment-to-moment variability tracing, then the baby's probably okay, especially if you see accelerations periodically. And there's strict definitions as to what those are, but when you know it, you see it. So even if the baby's heart rate's dropping once in a while, even if the baby's heart rate's going up for a little while and coming down, if the variability during those periods of baseline is moderate and you see occasional accelerations, that baby, I will say, is 99.9% likely to be just fine. But if you then add all these other things, which leads to the disagreement among doctors and midwives alike, that's when we get into trouble. So when we get down to the very, very basic principles of what we're looking at here, it actually can be a technology that is useful, but it's not how it's being applied. So I just wanted to finish with that.
Man. Well, more than awesome. If anybody's listened to more than one or two episodes of this podcast, they know that and Dr. Morgan, our producer, is probably smiling. There is no one who loves the granular details more than me. Even when I make a plan, I'm like, you know what, with this one, let's just keep it high level. Let's keep it big picture, whatever analogy you want to choose. 30,000 foot view. I can't not go into the details. So this is the Experience Miracles via Granular Details podcast. Okay. So I love it, man. You're right in line with us.
We're changing the brand a little rebranding.
Yeah, totally. Well, here's the net take home for everybody. And this may be the first time you're hearing this stinking word, variability. Just like other podcasts, first time you'll hear the word subluxation, dysautonomia, dysregulation, vagus nerve. We're about to go polyvagal theory and more vagus nerve. And that's okay if it's the first time you're hearing these terms. What our job is and what our prayer and our mission is to have them first be introduced, second make sense, and third, and number 3 is the most important by far, be useful. Help you make better, stronger, more confident, empowered, and informed decisions for your family and for your child at every one of these moments. And those decisions right there during birth, that's a big one. You'd be hard pressed to say there's other bigger ones than that. So variability is a word that we can continue to thread throughout the rest of our conversation, because variability in terms of heart rate monitoring, HRV, heart rate variability, when it's good, those are the best outcomes by far for moms, for preconception, for pregnancy, for postpartum. A strong, resilient, variable heart rate and nervous. And again, it has nothing to do with the heart, by the way. It is the nervous system we're measuring with this. Central autonomic nervous system function. A solid variability is so good for baby to latch, to soothe, to nurse, to digest. A solid variability is essential for a child to go through all their motor milestones and developmental milestones on track, on time, in sequence, to end up with this perfect, wonderful, ideal outcome. Now, the opposite of variability, the opposite of that resilience and adaptability is what's called subluxation, sympathetic dominance. And so there is often an injury, but more commonly a multitude of injuries and stressors, physical stress, chemical stress, emotional stress. We've nicknamed them 15, 16 years ago, the perfect storm, that shows up early during a child's nervous system maturation and development, moms and dads, and it shifts it off track. and it shifts it to a fight or flight, protective, shut down, sympathetic dominant response, which is the opposite of variability. And so what's awesome is this is something Dr. Nathan knows all about in those moments and knows going forward. Hey, we not only want to start with great variability, because how we start has a lot to do with how we keep going from there. So my question from that here, Dr. Nathan, is when we look at oxygenation, because that is a world then that you know big time, because like you said, the typical decision making is, and Dr. Stu on his podcast, he really did do it. He's like, they start with, let's not have a dead baby, and everything else is kind of just the other side of the coin. And it's like, there's a lot of speaking of variability, there's a lot of variability in outcomes on the other side of that coin. And so these interventions, they may stop the real bad thing, but do they start other bad things? Do they start the perfect storm? Do they start the thread that begins to unravel? And that thread may not show itself symptomatically, diagnostically until age 3, until age 5, or even later. And so that's why that mom who called you on that phone, what a brilliant mom to tap into her innate instincts and go, did birth have something to do with this hypoxic? Now, for me, I was studying this. I was all about this. I couldn't get enough of learning this. And then God had a plan for me. And God said, here's your son with a hypoxic birth trauma happen right before my eyes, and a 6-week NICU stay and ECMO and everything else, and the worst EEG and MRI findings. And so God gave me that absolute extra dose of clarity that this is a link that needs investigation, needs to be empowered and put out there. So let's stay nerdy. Let's stay granular. If a child struggles, and so obviously, lack of oxygenation has a scale too, right? And C-sections and other sort of interventions, they may hold off the worst of deoxygenation that would lead to a cerebral palsy diagnosis. But the other side of that may be respiratory issues, may be sleep difficulties, and the nervous system's number one thing that pisses off the nervous system and triggers fight or flight response instantly is low oxygen. And it doesn't need to go way low. It can go just a tiny little bit low, and the nervous system rings the 5-star alarm and goes, something really bad is up here. Put me into fight or flight. So a baby's oxygenation in those early years is essential. So you also had, you had an awesome post where you were investigating the conversation around autism after that phone call. And you also, on your Instagram page, which everybody, you got to follow Dr. Nathan. We're going to link it up and go through in the show notes. But even this seems like a conversation nobody wants to have either. So let's have it, is SIDS. And real big oxygenation challenges after. How come nobody, besides back to sleep, why is that all we've come up with in all of these years to try and investigate? So let's put our inquisitive minds together here. And where does your brain go with babies' oxygenation, breathing, respiratory, after birth in the coming weeks to months? What do you see cause trouble there?
Well, let's so obviously we need to breathe, right? We got to breathe. Our lungs open, air goes in, we relax, and the air goes out. And there's all this stuff that happens at these little tiny, air sacs and whatnot. And if something were to interrupt not only the availability of oxygen, but also the availability of oxygen to get into and out of your airways, right? That's a problem. But then, of course, we have a brain that tells us how fast to breathe and all that. So there's all these different factors. But before we talk about SIDS for a second, because we're going to get granular again, let's look at asthma. How do we treat asthma? Like a 16-year-old has an asthma attack and they grab for something that you squeeze and you breathe in. It's called Ventolin or albuterol. It mimics epinephrine. And then, this has become a chronic issue, young ladies. So let's put you on another inhaler you take every day. And this is going to be a steroid, right? Which is a mimic of cortisol. So we're giving you 2 of your adrenal hormones to keep you alive. And yet nobody ever asks, why is this kid not able to stay alive without external steroids, stress hormones? If we're not able to recognize that this kid with asthma has been probably under so many allostatic stressors that now their body doesn't have the reserve to keep air going into and out of their healthy 16-year-old lungs, then we're obviously missing a big potential solution to a very, very highly morbid condition for people aging, age 10 to age 80. And so when we consider this SIDS conversation, if we're going to separate this from the nervous system, we're making the same obvious mistake in separating the nervous system from the body when we're treating asthma. So the SIDS thing has become interesting for me because there was a moment, Tony, when I was like, I don't believe this. Like, I don't believe that that's actually what I'm told about SIDS. I don't believe that that's what happens, where a baby just stops breathing. Yeah. Later, I discovered I was actually wrong. It is what's happening, but it's for a different reason than I was given, which was basically, we don't know. I started studying what, really the vagus nerve, right? In sort of the total sum was polyvagal theory, where I learned that the vagus nerve doesn't just have a braking mechanism. It also has a function above the diaphragm that helps us connect and relate. You and I both have a lot of smile lines. We like living in the ventral vagal state. That's the state that allows us to be intimate with our partners, to connect with our friends, to socialize, to connect, to feel the good vibes. You can't get there if you're in a state of fear, as if the world is out to get you at all times. But when does that state of fear begin? I mean, of course, most of us are worried about getting our taxes paid, keeping our job, being productive at our job. And when you get more productive, they give you more work, and then you're expected to be more productive. Doctors and nurses are highly susceptible to stress because they have no reserve. They're living in a sympathetic state, fight or flight. But for these babies, these babies don't have stress. They're not working. They don't have a lot of these implements that we would, maybe have to address in our own lives. So what's happening for a baby? Well, a baby's nervous system is developing in kind, as you mentioned, inside the mom's uterus. And then it's actually finalizing its establishment up to, but probably beyond 6 months of birth. Yeah. So why is this relevant? This is relevant, Tony, because the way that babies come into the world really matters to their long-term health. Yeah. A baby that comes into the world being immediately exposed to a bunch of actually dangerous things. I mean, we can list them off. They were induced. They were forced out of their home early. Then, or maybe we augmented. Maybe we ruptured the waters, and there was this dropping into the pelvis. Like now that the waters are flooding out before the baby was even, finished counting its fingers. Right? Maybe a C-section. I mean, the hellscape that is a C-section operating room is not a place where a baby would probably feel very safe coming in. We have the needle sticks, like the vitamin K. We have the eye goop, the erythromycin ointment. For little boys, it's downtrending, but a lot of little boys are still getting circumcised. So all of this stuff put together does not create a very nice, safe environment. And so the baby, comes into the world in a state of an excessive sympathetic tone. Yeah. And it's the role of the mother and the father to help them co-regulate. And they need to be in that ventral vagal state for this baby to go with their gut instinct that, you guys, I can attach to you because you're going to keep me safe. But if we close our eyes and imagine, what would it be like to have a baby? You're not going to imagine a hospital room with all of this cacophony of noise and sharp things and loud noises and weird smells and scratchy sheets. What I would imagine if I was going to be born is, man, it'd be so nice to be on my mother's chest, hearing her heartbeat, feeling her chest rise and fall, and mom and dad talking to me like ASRM for a baby. Like, oh, my little sweet Nathan, look at your little fingers. You have dad's chin. You have little blue eyes. Like, oh, all of that is helping to bring that nervous system into a state of feeling safe in the world. Yeah. And that can start and must start moments after birth. So when, as you and Dr. Stu talked about, we're only looking at dead babies and or the lack thereof, and thank God there's an absolute low risk of babies or moms dying in really around the world, but especially in the United States. Even though we're behind all the other developed nations, it's still a low absolute risk. Relative risk is increased over our friends in Scandinavia and Europe and whatnot. But the point here is that if our only metric is if the baby and the mom are alive after this, that's a pretty darn low bar. Yeah. What about that baby's long-term health and this floating brain of their immune system and the mind-body connection, which is not just the brain, but it's actually their emotions and their intellect? How does all of this end up being situated from the moment you get that positive pregnancy test to the moment your kid is learning to crawl? That's actually really, really important. And that's what I gleaned from Stephen Porges's work and podcasts like yours, and actually most chiropractors who are like, they get it, that this is not just a mortality question. This is actually important for your child's long-term well-being.
It's everything. And I think that's actually, I spoke about this a lot this week. We onboarded every Monday. We have these intensive patients come in, and it's the perfect storm. These patients are flying in from all over the world, and it's a lot of hypoxic brain damage kiddos, a lot of epilepsy, and a lot of deep autism cases, and a lot of chronic autoimmune, or all the above, in a lot of these cases, right? Because they have multiple conditions. And the conversation always starts, stays, and goes to, and it sticks with one thing from me to them, the nervous system. And I know that the number one thing that traditional medical, so non-inquisitive, go back to our beginning to tie it all together here, non-open-minded, non-inquisitive doctors, practitioners, and us, if we're being honest, if we've ever, a lot of us maybe have been in a season of our life, you're probably open-minded if you're listening to this, or we're at least prying it open a little bit. That's the prayer of the goal. But maybe previously you were closed off too. And when you are, one easy defense against this kind of chiropractic and this kind of conversation would be like, how the heck do you think you can help everything? Because what we've done with medicine, it sounds too good to be true. I promise you, probably one of the biggest hurdles we have to get across for my job, right? My mission on this earth, to get neurologically focused pediatric, to get this conversation about the vagus nerve, about the nervous system health, and how respiratory health dependent upon nervous system health, gross and fine motor development dependent upon the nervous system, sensory processing, speech, social, emotional regulation dependent upon the vagus nerve. Everything starts here and is here. And so we can have every conversation from this foundation. But what would close it off to someone before we even get into, minute 5 is, sounds too good to be true. That can't be. There's no way that talking about one thing, the vagus nerve, nervous system regulation, there's no way adjusting the nervous system in a way that would stimulate the vagus nerve, regulate the nervous system, and restore balance to the autonomic nervous system. How could that help everything from asthma to autism to ADHD? Well, because we're not focused on the asthma or the ADHD or the autism. We're focused on the abnormal neurophysiological function coming from abnormal vagus nerve and nervous system regulation, so dysregulation, and where that gets thrown haywire right at the beginning. And the reason this variability conversation, and Nathan, you took it perfectly into the vagus nerve conversation, we can have the same conversation regarding SIDS, to colic, to constipation, to chronic ear infections, to sensory, to autism, to ADHD, because that sequence is triggered right then and the nervous system shifts due to those perfect storm factors. Because here's 2 things, parents, if you don't know them yet, here's 2 more things granular to add to this conversation. Number 1, in those first moments of life, in utero, and then that first 6 months, and really the first many years, but the earlier, the more they qualify for these terms. These are sensitive, and actually an even better word, critical periods of neurological development. So what happens really good? The regulation, the co-regulation, the connection like Nathan was talking about, or really bad, like the perfect storm, the physical injury, the intervention, the jabs, the noises, the environment. Well, that nervous system is most plastic for your baby in those moments. So whatever environment it's exposed to early, it will become hardwired forever. We can change it, we can improve it, but its pre-wiring is there. Second, there's an anatomical thing we can talk about with all this. The vagus nerve is a cranial nerve. And I know we're on a podcast, so you can't see me kind of shredding this out with my hands if you're on YouTube. Yeah, right. And so this vagus nerve, cranial nerve number 10, and it branches from the brainstem, comes down through the neck, all the way down through the thorax. Nathan, you mentioned before about the ventral and above the diaphragm. This is why kids who have physical birth interventions like C-section, forceps, vacuum, or manual assistance of any kind, the vagus nerve, here's it summing it all up. The vagus nerve makes its way from the brainstem down through the neck to the heart, to the lungs, to the digestive system. We've always known that. The vagus nerve also makes its way to our eyes and to our sensory affect and emotional social regulation system. And Dr. Porges, another Chicago boy, taught us that. And so wherever this vagus nerve, anywhere along its tract, its actual physical anatomical tract, it's very sensitive to physical obstruction. It's very sensitive to what's called misalignment and subluxation of the cranial bones and the upper cervical, and a lot of chiropractors even miss this, Nathan. This is not just an upper cervical conversation. Chiropractors, if you're listening in, the vagus nerve doesn't start in the brainstem and stay in the brainstem. The vagus nerve starts in the brainstem and goes all the way down below the diaphragm. So all the way down. So fast birth, actually, buddy man, we see a huge incidence of asthma, chronic respiratory issues, anxiety with fast births because they didn't get not just cranial molding, but cervical-thoracic molding to integrate and activate and stimulate the vagus nerve. So I'm on one right here, but the vagus nerve is sensitive to physical injury. The vagus nerve is sensitive to chemical injury. It really exists right in that. It exists in the brainstem, which is actually the thinnest blood-brain barrier anywhere. So chemicals inhaled, ingested, or injected will wreak havoc on the vagus nerve more so than any other part of the nervous system. And that's not good because the vagus nerve is the most important nerve in the whole body. And the vagus nerve is extremely sensitive to emotional stress. So what is the perfect storm? All of those things early. And that is why, whether it's an infant and we measure their vagus nerve function through HRV, or whether it's a teenager and we measure their vagus nerve function through HRV, or whether it's, we'll leave us off of this conversation for now, it's us parents, right? And we measure our HRV. It's not good right now. So what is good? So let's go into fourth quarter, buddy man. So what is good?
I just realized that we didn't actually draw the connection between what you said and why some babies die in their first days or weeks of birth. So real quickly, just 60 seconds, the babies that have the highest likelihood of dying of SIDS are preterm babies. Why would that be? Well, they haven't been in the womb developing and co-regulating inside the uterus with mom. And then, of course, those preterm babies get whisked away to the NICU where they stay in an incubator for maybe a month or so. So they're never actually getting that co-regulation with a person they can safely attach to. And naturally, because they don't have this full complement of the upper vagus, the lower vagus, and the sympathetic, these auto-regulatory systems are not firing on all cylinders. And therefore, in a household where there's smoking, is it the cigarette smoking? Maybe. Is it possibly also because this baby is not co-regulating with parents? It's not a blame thing or a shame thing. We have a socioeconomic disparity in our country whereby lower income families tend to have a higher rate of SIDS. Probably because they aren't even able to regulate themselves because we're pushing them to work 3 or 4 jobs and not even able to make their bills. Like, this is a super complicated conversation that applies not just to babies, but also to us as adults, to the healthcare workers who are completely dysregulated. And then, of course, that's almost like a separate perfect storm for what we're seeing happen in maternity care. Is we have a whole bunch of dysregulated nervous systems that are not able to even see and connect with one another in a loving way. So just wanted to throw that in there, that this SIDS thing, this actually could be the missing piece for this otherwise collective shrug that we get when we ask about SIDS.
Nailed it. And the neurology behind a preterm baby is because this is just how God designed us. The nervous system develops in a certain sequence, and it is more sympathetic dominant early on. It doesn't, especially the vagus nerve and the parasympathetic regulation system, it doesn't reach full maturation until many months outside. And so if you are born to the outside earlier, you start with a shorter end of the stick, neurologically speaking, and then are exposed to all the stress of the NICU and lacking everything else. So it's its own, specified perfect storm in that conversation as well. So taking the perfect storm, this has always been the dance that I try my best to dance, because my least favorite job is the job that I spend a lot of time on here on the podcast, which is going backwards and shining the light on these things. But the reason that also becomes my favorite part of my job is because when you reveal what went wrong for families and you share the truth and the actual science behind these things for them, you also then simultaneously are revealing the options, the care that will get to the root cause. So you're revealing, the solutions and the things that are going to help as well. And so from that point of the conversation, when we look at it, or you see it from there, I know in your clinical practice, taking care of mom, taking care of baby, and then baby arrives and Dr. Stu was talking about longitudinal care. How much do you speak to this co-regulation? How much do you plan to help them going forward with nervous system health from your perspective? And what are the things that you think are key to nervous system regulation and development from mom? Because that still continues. I know technically the umbilical cord is no longer connected, but that touch, that skin to skin, those things from mom to dad, how important does the nervous system regulation conversation stay going forward? And how do we help? What are some things, what are some action steps we can send folks home from this podcast to say? Obviously, get a chiropractor on your team, get those adjustments, get that empowerment. But what else can be done in that world?
Yeah, I think the sort of daily life thing is what I'm currently an expert in. And let me also say to everybody out there, like, I am not an expert in childbirth. Like, I've got a board certification. I'm actually dual board certified. I've got all that stuff, but I've never given birth. So what I learn about this is by listening to my clients. And that's the only way. And my wife, who had a home birth, 90-minute home birth, speaking of fast labors, no augmentation. The baby just came out asleep and on her chest, and it was beautiful. But what I am an expert in is my little girls. And every day that I wake up, it seems like it's a new thesis I have to write. So I've got a 4.5 and a 2.5-year-old. And the one thing that is really lacking in my world is having some support for my nervous system, and especially my wife's nervous system, as we're trying to mirror the green state, as Poor just described it, this ventral vagal, connective, kind of loving, heart-centered space where our little girls, who both have language now, but they still have a gut feeling as to whether or not dad is safe right now. And if dad is just angry and pissed and being very short with them all the time as they're trying to learn with their tiny little bodies and their growing brains, if they don't feel like I'm a safe person to be around, they're going to live in a state of like threat in their immediate home surroundings. So from the moment you have your baby and you bring your baby home, I think first and foremost, anything out there that can help to keep your nervous system better regulated, which might, guys, it might be turn off the stinking CNN or Fox News. It doesn't even matter. Just turn off the Fauci testimony, which I listened to for 3.5 hours. Just turn it off. You have to give your nervous system a break. And then probably of all of the tools, if you can't go and see Dr. Tony and learn from like these wizards of chiropractics, or come and stay in my house for a couple months and I'll teach you what I don't know that, doesn't work. Just remembering that like your breath is the primary driver of your vagus. And if you're able to remind your nervous system that you're safe, that is going to ultimately result in you smiling, you being able to love, you being able to be intimate again with your partner. And then your little kids are going to melt into you. And there's a big difference between just patting a baby on the butt and when a baby actually melts into you. Yeah. They will not do that with you, dads especially, if you don't see yourself as being a part of the caretaking dyad in the home. They need to feel like my dad has got my back through hell or high water, when even I just need to scream and there's no solution, that my dad will be here and bear witness to that. And while you're doing that, Dad, there's not a problem to solve. Yeah. You can hold them, you can breathe, make sure you are consciously calming yourself down, breathing in through the nose, out through the mouth. Take 10 of them and then go in, hold them, let them scream, and love them. And they will melt into you. That is co-regulation, and that is what so many of our kids are missing nowadays. You really just need to invest in slowing down, calming down, and then that will be mirrored to your children, and they will actually learn that the world is not an unsafe place. But it starts with you guys. It starts with the parents.
Could not be more happy that you took us down that road here. One thing, when you're a pediatric chiropractor, when you have a pediatric podcast, everybody thinks that, and I have to always be conscious of this, that 100% of the content is going to be focused on our kids' health. The only way we can focus 100% of the conversation on your kids' health is to make sure we don't focus 100% and we include you in it. And so our team is probably smiling as they listen to the recording of this, Nathan, because I've asked some form of this question to every one of our pediatric or prenatal experts, and pretty much every one of them, this is so cool how I see God connecting this all together. We're going home with every podcast episode, learning a ton about our kids' health, learning a ton about how we can have healthy pregnancies that are empowered and variable and vagus nerve bumping, baby. But we also are learning dang, we're important. Our nervous system matters most, and taking care of ourselves is the first thing we must be sure to do to have our kids regulated and healthy and calm and safe. And that always, it's just innately, for whatever reason, I don't know, it's way beyond my pay grade too and my expertise. I don't know why we're defaulted as parents to think we're so dang bad at our job. like even you, buddy, man, when you started that, you're like, I bet you're a zillion times, that's a big number, better at it than you probably give yourself credit for, in terms of you and your wife keeping your nervous systems in a good place for those beautiful baby girls. And so parents, we'll leave you exactly with that. It does absolutely start with you. And with that, that's a serious responsibility for your children to develop healthy nervous systems. Yours has got to lead the way. For your children whose nervous systems may have been damaged, injured, and are currently dysregulated, make sure that your journey to help heal their nervous system includes healing yours. So I actually don't tell the truth when I tell people I'm a pediatric chiropractor, because I adjust moms and dads too. And I'll leave us with a joke. And here in Illinois, we love our mandates. So I've just mandated everyone. Just kidding, I haven't. That's sure as heck not what I've done. But what we it felt like a good Illinois joke there with the stuff we don't love, mandates. But the truth is we are highly, if I ever get pushy, which God made me in the antithesis of that. I am a big empathetic pansy, truthfully. But if I get pushy in my practice, it's with moms and dads of my perfect storm kids. And I say, and I usually, I don't give them any choice. I kind of surprise them with it. And I say, guess who's up today? And they're like, oh, is she getting another adjustment? No, but you are. Get your HRV, get scanned, get on this table. And I actually want to close with this. And I thank you so much, Nathan, for joining in this thing that I'm going to close with. I feel strongly you are now just a valued, incredible, impactful part of our Experience Miracles community. What we want to build with this podcast and our PX Docs platform, all of our socials and everything we do, we want you to know that you belong here. We want you to feel a part of this family and this community. And we need you to know that you will be listened to here. You will be empowered here. You will be guided here to the things, to the doctors, to the places that will help you heal. But most importantly, you'll be taught how to do it yourself. My favorite person ever is Dr. Bruce Lipton. Epigenetics. And the key to health, you nailed it, Nathan. Like, as much as I want to say, go get adjusted. And that may be the first thing you need to do. It's like Mario Kart. That might be the cheat code you need to win the race because your nervous system might be so worn out right now. You need us to kind of shove you back on the field a little bit, and get your nervous system going that way. But I promise you this, if you really do put yourself first, you're also putting your kids first. And we probably have to get to say that on every podcast, because for whatever reason, us as parents, that is not a message that feels right to us. It feels natural, and it feels like the right thing to do is to just put ourselves last. And Nathan has seen it clearly in his clinical practice, which is why he took us there in closing. And I've seen it again and again in our clinical practice. Healthy kids, regulated, adaptable, resilient kids, they come from healthy, vibrant, regulated, adaptable, and resilient parents.